My motivation for the malaria vaccine roster is that I was born and raised in malaria endemic area and have therefore have personal experience of the devastating effects of the disease. Therefore, my involvement in this roster fosters a sense of social responsibility and personal fulfillment, as it will enable me to contribute my quota to lessening the effect of malaria that I experienced growing up as a child on children today and the future, and which will directly impact public health outcomes. It will also enable me to contribute to a global health initiative that combats a disease that disproportionately affects vulnerable populations. By participating in this roster, I will play a key role in the implementation and rollout of malaria vaccines that will potentially save lives of people living in heavily burdened malaria countries. Finally, my individual contribution to the collective effort to malaria eradication will ultimately improve the well-being of communities worldwide. I intend to support the roster by contributing to the provision of technical guidance, coordination, and communication with WHO regional and country offices by leveraging on my knowledge and experiences in the following areas. I have a strong foundation in public health with expertise in vaccine-preventable diseases epidemiology, immunization programs, with an understanding of broader context of global health issues and principles of disease prevention and control. I have in-depth knowledge of malaria, including its epidemiology, transmission dynamics, and control strategies. I am very experienced in the planning, implementing, and evaluating vaccine introduction programs in different countries such as Ghana, Ethiopia, and Afghanistan. I have experience in data analysis with strong analytical and problem-solving skills, and these are essential for identifying challenges and developing evidence-based solutions. I have the ability to collaborate effectively with diverse stakeholders, including government agencies, non-governmental organizations, and community groups. I am sensitive to cultural, social, and political context of issues, and this guided me in delivering essential interventions to local needs and overcoming barriers to vaccine acceptance and uptake in countries that I have worked. By possessing these experiences and knowledge, I can make meaningful contribution on the provision of technical guidance, coordination, and communication with WHO regional and country focal points related to malaria vaccine introduction, ultimately helping to advance global efforts to combat malaria and improve public health outcomes. Currently, malaria presents numerous significant challenges that are of concern to WHO. First of all, despite recent achievements in malaria eradication efforts, malaria remains a leading cause of morbidity and mortality, especially in sub-Saharan Africa. The emergence of drug-resistant strains of malaria parasites threatens the effectiveness of current treatment methods. Although malaria vaccines are available, they are limited in terms of efficacy and widely acceptability. Aside this, insecticide-treated bed nets and indoor residual spraying that are the major malaria vector control measures are challenged with insecticide resistance and logistical issues in reaching remote populations. In addition, socioeconomic factors such as poverty, limited access to health care, among others, contribute to the persistence of malaria in many malaria regions. I therefore suggest WHO focus on the following areas: enhancing research and development to develop more efficacious malaria vaccines, innovative treatment options, including those targeting drug-resistant strains and insecticide-resistant vectors, implementation of integrated vector management strategies aimed at controlling mosquito population and transmission reduction, strengthening surveillance and response to detect and contain outbreaks, enhancing collaboration with NGOs and other stakeholders to improve access to malaria prevention and treatment interventions, addressing social determinants of health such as poverty and sanitation, mobilizing resources and advocating for increased funding for malaria control. By addressing these challenges and prioritizing these key areas, WHO can make significant strides towards achieving its goal of a world free of malaria. Thank you.